Broadcast Center in Los Angeles. This is KCAL9 News at 7 a.m.
Well, it is October, Breast Cancer Awareness Month, and breast cancer is typically detected either during a screening before symptoms have developed or after a woman notices a lump. And joining us today is Dr. Jason McKellop. He's a radiologist with RadNet Imaging. Good morning. Thanks so much for joining us.
Good morning. Thanks for having me. It's a pleasure being here.
So often we hear women should be doing self-checks, and of course once you hit 40 start getting those mammograms, but we were talking there's a little controversy about these self-checks now.
Indeed, there's some controversy around this topic. In fact, the recommendations have changed recently such that women are no longer encouraged to do self-exams because they've found that women are not very reliable in detecting disease themselves. And for this reason, screening mammograms become even more important because the onus falls onto the physician or radiologist like myself to detect the disease as opposed to putting the responsibility into the hands of the patient.
Would you say, though, that it's good for both things to be happening? Because myself and many others find lumps, and so
I would say that is a very important thing. A general awareness of one's own anatomy is critical. And I encounter patients very frequently who discover their disease themselves. And they bring it to our attention, and that's certainly helpful. But as a mandate or a general rule, there is no longer a recommendation for women to examine themselves. But I would certainly encourage the awareness or a general awareness of one's own anatomy, certainly.
And there's been a lot of controversy as well about when women should start getting those mammograms.
Yes, unfortunately there is controversy around this topic. In our field, we don't see it as being very controversial. The age is 40. Starting annual screening at age 40 for average risk women is the rule. Unfortunately, like you mentioned, there is this controversy. Various task forces have recommended varying ages, but we go by age 40 and annual screening thereafter.
And one of the things that, I don't know if it's recommended for most women, but 3D mammograms, especially if you have dense breasts.
So 3D mammograms are now the state of the art in terms of mammographic screening. Mammograms, if I should back up and just describe the technology, it's an X-ray image of the breast. And that typically gives you an image of the breast in 2 dimensions, like a flat sheet of paper. But 3D mammograms or tomosynthesis allow you to scan progressively through the anatomy as you would a CT scan or an MRI. So you get a lot more detail from that imaging examination. And the benefit is greater in women with dense breasts, but we still see a benefit nonetheless in women who have less dense breast tissue.
And let's talk a little bit about dense breasts, because a lot of women don't know that they have dense breasts. A lot of times they don't even find out until they do have a diagnosis of breast cancer. How common are dense breasts in women?
Very common. In fact, half the population has dense breast. So let me describe dense breast briefly. By backing up and talking about the anatomy of the female breast. The female breast is composed of 2 things, fat and fibroglandular tissue. On x-rays, fat looks black and fibroglandular tissue looks white. Dense breast is basically a higher relative concentration of white to black. Like I mentioned, half the population has a higher ratio of fibroglandular tissue, therefore white to black, and the other half of the population has less dense breast tissue.
But by looking at someone's anatomy, just looking, you can't tell if they have dense breasts.
No.
There's nothing that shows a woman that she might have dense breasts.
No, breast density is something that we derive or glean from mammograms.
It has nothing to do with the size of your breast or anything like that.
No, it's a mammographic or imaging appearance that we could tell on imaging.
And so women do have a right to know, though, and they should find out. Does that increase your chances of getting cancer, breast cancer?
It's important for a couple reasons. One, dense breast tissue makes life a little bit difficult for us as radiologists because breast density can obscure disease. So if you can imagine finding a marble in a glass of milk, the milk or the white would be the fibroglandular tissue. It would be hard to see that marble within that glass. Compared to a marble in a glass of water, which would be a less dense situation where you could easily see that marble. So breast density can obscure disease when you have more dense breast tissue, and there's a slight increase risk of developing breast cancer when we look at the average risk population in women with dense breast tissue. So those are the two main things that are related to breast density.
All right, Dr. McKellop, thank you so much for joining us and really giving folks more information. Of course, October is so important, October Breast Cancer Awareness Month. And for more information on breast cancer awareness or with Dr. McKellop, or you just want to see this segment again, just go to our website, KCAL9.com, and click Seen on TV. We'll be right back.